Hi, welcome to my journey. In the last video I was talking about how I found out that I have cancer, and I moved to New Mexico here to be with my family. And I want to talk about, when they talked about chemotherapy, some of the side effects of the medication, and then the next video is going to be about what I am actually doing now for recovery. So they wanted me to do chemo, and Herceptin is one of the drugs that they would use. And for me, with a heart issue, the Herceptin could cause heart failure in the first 24 hours. I don't know about you, but if the benefits must outweigh the risk, and if the risk of not doing it means I live, and doing Herceptin means that I'm taking a chance of dying in the first 24 hours, that was not a risk I was willing to take. And then the radiation, the side effects of radiation is heart damage, lung damage, future cancer. That was very concerning, and it can also eat through your ribs. So those are also, with a already bad heart and bad lungs, also risks that I could not take. Some of the other ones, I thought I had it laid out here. So the side effects of the ones that they wanted to give me were decreased blood cell counts, allergic reaction during administration, numbness in hands and feet, low blood pressure, body aches, nausea, vomiting, diarrhea, sore mouth and throat, hair loss, of course, fever over 100.4, chills, signs of infection, excessive bleeding or bruising, shortness of breath, COPD, during drug infusion, tingling or numbness in feet or hands, body aches unrelieved by prescription medication, nausea or vomiting that is not controlled in the first 24 hours of the medication, inability to eat or swallow. Another one was trastuzumab. Oh, that's Herceptin. Okay. Chills, pain at tumor site or in abdomen, back, shortness of breath, muscle weakness, stiffness, rash, headache, difficulty breathing, nausea, vomiting, diarrhea, loss of appetite, sleeplessness, unusual bruising or bleeding, swelling of the feet or ankles, rapid heartbeat, upper respiratory tract infection, excessive coughing, and fever over 100.4. And I also read that it can cause heart failure in the first 24 hours. That's not in here. Another one, diarrhea, nausea, vomiting, fatigue, loss of appetite, dry skin. And now if you take all of if every one of these has the same reactions, those side effects just sound really, really bad. Another one, denosumab. I can't even pronounce these things. It causes reduced calcium levels, jaw pain, decrease in jaw density, fever, chills, cough, rapid breathing, painful or frequent urination. And this would be pretty consistent. After I had the surgery, I was having a problem, which I still have. I had surgery and now I have numbness and pain in my leg. So they gave me a medication called gabapentin, and here's the side effects of it. Thoughts about suicide or dying, attempts to commit suicide, new or worse depression, new or worse anxiety, feeling agitated or restless, panic attacks, trouble sleeping, new or worse irritability, acting aggressive, being angry or violent, acting on dangerous impulses, an extreme increase in activity and talking, mania, other unusual changes in behavior or mood. I don't know about you all, but those side effects are like, wow. And then the thought of mustard gas. Mustard gas is a very horrible toxin, and yeah, I mean, the dosage isn't enough to kill you, but you keep on putting that in your body over and over and over and over and over and over again. It builds and builds and builds. It builds up, and you're just becoming toxic. And some of the things that they say with chemo, if when you go to the bathroom, you're supposed to flush twice. So imagine, okay, I'm 3 hours away from the hospital where I would be getting treated here. In Kentucky, I was an hour away from the hospital. Here, I'm 3 hours away. So that's another thing. If Herceptin caused heart failure within the first 24 hours, I would be 3 hours from a hospital. I mean, I had heart failure when I was in 2009, and if I hadn't got to the hospital pretty quickly, I would have died. They had to give me CPR, and that's something I don't want to go through again. So some things that I've been learning is about all the toxins and how toxic not only medication is, but talk about the reason that I ended up getting cancer. For one, in Kentucky, everybody in the hollers burns their trash, so I burned a lot of stuff. I mean, there had been water damage in a wall, and they had to replace the insulation and drywall and stuff. I burned that stuff. So you think that's probably part of how I got COPD, not to mention I smoked for many, many, many a year. I quit smoking in 2016. Praise God, I still don't smoke. My dad smoked for 60 years and ended up with lung cancer. And stage 4 lung cancer, stage 4 COPD, and he died. He did chemo, and he still died. My father-in-law, he did not smoke, but he ended up with lung cancer. He did radiation, and he still died. As a matter of fact, the hospital treated my father-in-law for pleurisy for months and months and months and months before they finally diagnosed him with cancer. And by the time they diagnosed him, he was stage 4. My dad, he was in and out of the hospital with the COPD, and they never diagnosed cancer. They diagnosed him with cancer, I believe, in September, and he died in January. My father-in-law died 9 weeks after diagnosis. Radiation, chemo did not help them. Another reason why I refused both. Not to mention all the toxins and, like I was saying, if you're supposed to flush twice with it says flush twice with the lid down. Because you're toxic, So if I left the hospital on my trip home, I would probably stop at a gas station twice. There's no putting a lid down when you flush a toilet, and that's directly after finishing chemo treatment. So that is when you're the most toxic. And anybody can say they are not toxic. I found out after a PET scan, after a lot of these scans where they use that contrast, or not the contrast, but the radioactive dye, you're toxic. You're radioactive for several hours. And, like Chuck Norris's wife died from, she was sick from an MRI. So, we now know, and I'm sure they've always known, that all of these scans that we're taking, the MRIs, CAT scans, I've had several of the nuclear stress tests for my heart. So the nuclear stress test, and then I had a nuclear study done that was to check for blood clots. A lot of MRIs before I ended up at the pacemaker. All of these things cause cancer. And then there's our food. All the animals, if people know this, all of the toxic stuff that they are pumping in the animals, the steroids, the antibiotics, all the antibiotics that they're sticking in the farm animals is causing people to be immune to antibiotics, because every time you're eating meat, you're getting antibiotics. What goes in animals goes in us. Pharmaceutical companies, FDA, they don't care about any of this. I'm gonna get banned from Facebook or YouTube and everything else. But yeah, they know that all this stuff is toxic. The stuff that they're pumping into animals to make them grow twice as big as they should be. A chicken grows to full size within a couple of weeks because of all the stuff that's pumped into them. And you know how horrible that is? People have no idea. I mean, to look at the cruelty involved in what's happening to the animals just for the almighty dollar, so that they can make more of a profit. And they all know how sick that they are making people. People are getting cancer from what they eat. What we eat, what we wear. I found out that there's even formaldehyde in some shampoos. And you can go to, there's a website, I can't think of the name of it right now. I'll figure it out and I'll post it on my next post. But you can find out how toxic the stuff is that you're using. The soaps, shampoos, laundry detergents, cleaning products. All of these things have cancer causing ingredients in them. Even using plastics. Plastics are horrible. The BPA, and they know this too. And then pans and stuff, bleached metal, and so much toxin out there. And that is what is causing our cancers, diabetes, gout. It's all in what we eat. And they say that there's such a little amount that it's not going to hurt you. Well, when you take that little amount and you just keep piling on every day, I mean, look at how toxic pork is. But yet people eat sausage. I loved sausage. That was just one of my favorite things. That was my favorite. I loved, I own ham. I actually quit eating meat a long time ago, but occasionally on my way to New Mexico, my ex-husband helped me get here, and he went to Smashburger. I'd never been there before, but it was hot dogs. So if I was going to eat anything horrible, it had to be hot dogs. But yeah. So the medications are causing our sicknesses. Medications, meat, the food. Yeah, I totally eat a plant-based diet now. I don't eat meat. I don't eat anything out of a can. I don't eat sugar. I don't eat sodium. I have found out all of how bad all of this stuff is, and so when I come on again, talk about what I have done since I came here and where I hope to go from here. I'm waiting right now on results to some blood tests, and I go next week for some other blood work. So gonna see where everything stands. So thanks for listening. God bless you for being there. Thank you.